everyone, my name is Brittany. I will be doing a head-to-toe assessment for my health assessment class. Alright, let's get started. Hi, how are you today?
Fine.
Good. My name is Brittany. I'll be your nurse. Is it okay if we do a head-to-toe assessment?
Yes.
Alright, first things first, I'm going to wash my hands. Proper hand washing, you use warm to hot water. Wash your hands for at least 20 seconds. So I'm going to do that real quick. Alright, everything we do today will be kept private between me, you, and the doctor. Is that okay?
That's fine.
Alright, can you tell me your name?
Julie,
Your age?
72,
What year is it?
2018.
And who is the president?
President Trump.
And what are we here for today?
A doctor's checkup.
Good. I ask you those questions to make sure you're alert oriented. You're oriented times 4, so we'll continue. Just going to look over your skin color, make sure everything looks okay. It does. Your skin color is normal for ethnicity. Your facial features match your mood. You're calm, content, cooperative. I'm going to have you stand, please. Make sure you have good posture, no physical deformities. Good. Can I have you walk to the TV and back to check your walk? Good. You look like you have good personal hygiene too. Do you shower daily?
Yes.
Good. Alright, I'll have you sit back down. Gonna get some vital signs on you. Check your blood pressure, pulse. Your blood pressure was 180/82, which is good. Alright, going to check a pulse. Check your respirations at the same time.
Mm-hmm.
You check a pulse for a full minute. Respirations, I look at your chest rise and fall. So your pulse was 73 and your respirations were 17, which is good.
Okay.
At this time, I would check your temperature. If I had something to check your temperature, which I don't, stick it under your tongue.
Okay.
Oxygen, I would check with a pulse ox. It would go on your finger. Normal is 90 to 100. You don't wear oxygen at home, so your oxygen level should be fine. We're going to go get a weight on you real quick. Okay. 164. Good. Alright, we'll get a height. I'm going to have you...
Hold it.
Yeah, hold it. Right about there. Five foot 3 inches sound about right? 5'2"?
I thought I was 5'4", but I must have shrunk.
It's alright.
Mm-hmm.
Alright, have you sit back down. Alright, so I already inspected your skin. Color temp, make sure you're warm. Good, nice and warm. Alright, palpate your skin. No swelling, edema, no lesions anywhere. Good. I'm going to check your hair distribution. This time, add gloves, Should put gloves on. We don't have them, but it's all right. Check for any infestations, lesions, bumps. Everything looks good. Your hair is evenly distributed. Color your hair. Good. All right. Check your nails. Look good. Capillary refill. Hold down. Should be between 2 and 3 seconds. Good. All right. Head I inspected. Made sure there was no abrasions, anything on your skull that was abnormal. I have to check your temporomandibular joint, which is right here. Gonna feel for it. Make sure there's no cracking or anything. Make sure your face is symmetric and any unnecessary facial movements. Can you open your jaw for me? Good. Everything sounded normal, which is good. No abnormalities in your face, no drooping. Everything's symmetric, so we can move on. All right, your cranial nerves, there's 12 of them. I'm going to check 2 through 12, so we'll get started on those. All right, first one's optic. So I'm going to have you stand up. Have you stand this way facing me. Cover this eye. Same one as me. So I'll have you stand about an arm's length away, which is good. And you're going to tell me what you see. I'm going to hold it down below and up high. You want to look straight at me and see if you can see what number I'm holding up.
2.
Try again.
This side's bad. 3.
Good.
2.
Good. Now we'll do the other eye.
1. 4.
Good.
This eye have macula. It's
Macular degeneration.
Yes.
All right, so we're going to check your eye with the chart here.
mm-hmm.
Have you stand back there at the couch. Put your glasses on. Going to have you cover one eye. You'll do one eye at a time.
Well,
So which line? Can you read this line here?
no.
No? What about this one?
No. Nope. 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 I can just see an E. That's it.
Right here?
That's
You
it.
can't see.
No, I got macula, honey. You can't. I'm blind in that eye.
I know. So you can't see these two.
Uh-uh.
Okay. How about the other eye?
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P.
What about down here?
T.
Nope. So you're
Yeah,
2200. So what you see at 20, people see at 200.
mm-hmm.
And then you got down here 2040. So what you see at 20, people see at 40.
Okay. Yeah. but
So
I
your
got-
left eye, you have macular
Oh,
degeneration,
yeah, I
which you're
cannot
basically
see.
blind.
I can't.
Okay.
That's eye shot.
So have you come back here.
Mm-hmm.
Next, we'll check oculomotor, trochlear, and abducens all at the same time. 3, 4, 6. So let me grab my pen light here real quick. All right, we're gonna check nystagmus first. You're gonna follow my eye. Keep your head straight. Good. No unnecessary twitching. I'm going to check pupils and see if they're reactive to light. Try to keep your eyes straight. Good. They both constricted. And then accommodation. I'm going to hold this here and go inward. So you keep your eye on this the whole time. Good. Alright, next we'll check trigeminal. That, I check your masseter muscle and your temporal. Checks like your chewing and stuff. Good, and then I'm going to have you open your mouth against resistance. Good. Alright, next we'll check your facial. You'll close your eyes. Open them. Smile. Frown. And then shrug your, or puff your cheeks out. Good. Good. Alright, next we'll check vestibular cochlear. So I'll have you occlude this ear over here. Like this.
Oh.
And then I'm going to whisper 2 words. You have to try to guess them, okay? apple and banana.
Apple and banana.
Okay, now we'll do the other side. Dog and cat.
Dog and cat.
Good. A little hard of hearing, which is normal for your age.
Really?
We'll check 9 now. Glossophryngeo. I'm going to have you open up your mouth. Say ah.
Ah.
Good. Now, I would check your gag reflex too, but I'm not going to stick this back there. I don't have a tongue compressor. Uvula went up when you said which is normal.
Mm-hmm.
Next is vagus. We know that's normal because you're able to swallow. Your speech isn't hoarse, so that's good. Next, we'll check accessory. Move your head side to side, up and down, and shrug your shoulders. Good. Now try to shrug them against my resistance. Good. And then lastly, we'll check hypoglossal. We'll stick out your tongue and move it side to side. Good. All right. I'll have you sit back down. Have you squeeze my hands. Good. Hold your arms out. Try to go down. Good. Have you pick your feet up. Push against my hands as hard as you can. Good. And then try to push down on my hands. Good. All right, I'm going to check your Babinski reflex, which is on your foot. Good. Good. Your feet are supposed to curl down, which they did.
Oh.
All right, going to have you stand back up to do the lumbar test. Going to have you keep your hands at your side and try not to move. Check your balance. Good. Now do it with your eyes closed. Good. No swaying, no abnormal movements. Good. All right, sit back down, please. And then I'll have you touch each finger to your thumb as fast as you can. Good. All right, so eyes we did with the Snellen chart. We're good there. I'm going to do a corneal reflex and the 6 cardinal positions. So for a corneal, good. You blink, which is normal. All right, watch my pen light here. Follow it. Keep your head still. Good. All right, I'm going to inspect your eyebrows, your eyes. Check your conjunctivas. Make sure they're nice. Good. If I had an ophthalmoscope, I'd look in the back of your eye with that, but I don't. So everything looks good there. Ears. Look at your ears. Check the pinna, the targus, mastoid process back here. If I had an otoscope, I would check your tympanic membrane, which should be gray, pearly, translucent. Don't have one of those, so I can't check that. If I were to inspect your ear with that, I would have to go up, back, hold the otoscope in there. We did the whisper test. All right, nose. Make sure everything's symmetric. I would check your septum again with the otoscope. I don't have that, so I'm just going to use my pen light. Good, everything looks good. Have you hold one side of your nose. Breathe. Good. Other side. Good. Make sure air movement is good. All right, I'm going to check your sinuses, your maxillary, and your frontal. So I'll push on those. Tell me if they're sensitive or not. Yes or no?
Just a little bit, because I have sinuses right now.
Okay. Mouth. I'm going to check your lips, tongue, soft palate, uvula, all that. So have you open your mouth. Try to stick your tongue out. Say ah.
Ah.
Good. Check your hard, soft palate, uvula. Everything looks good. Can you lift your tongue up for me? Check under your tongue. Good. Make sure your uvula was nice and midline, which it was. All right, neck. Gonna make sure your trachea is nice and midline. Good. No goiter. Do you have thyroid?
I have a goiter, I think. Not used to, maybe not.
No, it's not there. But have you had thyroid issues in the past? No.
I had a test done, but then
Okay.
nothing showed.
Check your trachea. Good. We checked your range of motion. Gonna feel your lymph nodes. Make sure they're not swollen. You check those to your mid-clavicular there. Those feel good, nothing tender. If you had a goiter, I would check your thyroid, all that. Have you move your neck to the side, 45-degree angles. Good. Check your jugular vein, make sure it's not distended. We'll do the other side. Good. Alright, your carotid, gonna feel that. Check for a pulse there. Good. Listen, make sure there's not any bruise over it. Any blockages. Good. All right. Move on to your chest. Just going to see, breathe in and out for me. Everything's nice and symmetric. One side's not raising. Go to the side. Make sure you don't have a barrel chest. Good. Gonna just feel, make sure nothing abnormal there. Good. Alright, so whenever we listen to lung sounds, we listen front to back.
Mm-hmm.
You have your suprasternal notch here. Your angle Louis makes your sternal angle down into your second intercostal space.
Mm-hmm.
And then your C7, which is what helps us assess for breath sounds, is the big notch right back here. So, I'm going to start by listening to your lungs. So I'm going to start at the apex, go side to side, and then I'll explain what I'm doing as I go. Deep breath in and out for me. Good, another one. Alright, then I'm going to go down from the suprasternal notch, the angle Louis, to the second intercostal space. Listen to your right upper and your left upper. Deep breath for me, in and out. Again. Good. Next, I'm going to go down to your fourth intercostal space. It'll help me listen to your right middle and your left upper still. Deep breath. Another one. And then I'm going to go down to your mid-axillary line at the sixth intercostal space, which helps me listen to your left lower and your right lower. Good. One more time. Guess get a little more over. Good. Good. So your left lobe only has an upper and a lower, and your right has three, upper, middle, lower. All right. Have you stand up so I can listen to your back. All right, turn this way for me. Thank you. Again, I'm going to go from the apex down. Just follow from where your spine is, in between where your shoulder blades are, so I don't hit over those. Deep breath for me. Another one. Another. 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 One more. Then we'll go over here for one more. Thank you. Ones were nice and clear. Alright, so we're going to move on to your heart. You can sit down for this, so I'll just do the front. So your heart, I listen to the valves. Your aortic is on your left side, your right side. Second intercostal space. Your pulmonic is second intercostal space on your left. Third, I go down to your tricuspid. Second is Erb's point. Third is tricuspid, and fourth is mitral. So we're going to listen to your aortic valve. Just breathe normal for me. This is right at your sternal border at the second intercostal space. I'll go right across your sternum to the second intercostal space on your left to listen to your pulmonic valve. Good. Your S1, S2 on both of those, that's normal. Go down to the third intercostal space, which is Erb's point. Listen there. Listen for S1, S2. Any S3, S4 is irregular heart sounds, which isn't good. Alright, fourth is tricuspid. And then fifth is midclavicular line, which is where your mitral is, which is right below your breast there. There we listen for the apical pulse. It's the point of maximal impulse. It's the most precise way to get your pulse by listening here. Normal 60 to 100. So I'm going to listen for a full minute. Good. 73. Alright. Move on. Have you lay down. Going to do your abdomen. Okay, so had you lay down. Just gonna, if you were in the hospital, we would have your gown up. I'd be looking, make sure everything's proper, symmetric, no bumps, lesions, anything like that, which there's not. We talked about it. So first, I'm gonna listen to all four quadrants of your bow. So listen for bow sounds. You must be hungry, your belly's growing.
Is it?
Yeah. Good. And if you weren't to have any bow sounds, you would listen for bow sounds for 5 minutes.
Oh, okay.
Alright, so next I'm gonna palpate it. Your belly's not tender, you haven't had any issues. Are you going to the bathroom alright?
Mm-hmm.
Peeing and pooping?
Oh, yeah.
Good. Is that tender? No. Okay, now I'm gonna do a deep palpitation. No tenderness? Good.
Just, you know.
Yeah. Let me make sure I didn't forget anything. Alright, I'm going to do an ileopastis test and an obtruder test. I'm going to have you put your leg, hold it straight up, and try to go down. No tenderness in your belly anywhere with that? Okay. I'm going to have you put your leg up, knee at a 90-degree angle like this. So bend it. There you go. In, out, in, out. No tenderness?
No.
No? Good. Both of those check for if you were to have your appendicitis. If something were to happen, they check for that. Alright. I think we're done there. Have you sit back up. So check your peripherals. I would check your legs, feet, arms, make sure nothing's cool. No lesions, edema, clubbing of your nails, which there's not because we did capillary refill. Pulses, I would check both of your radials like I did, full minute. Your brachials, which are right here. Check those for a full minute. Can feel those, +2, which is good. Same with your radials. Popliteal are on the back of your leg. Feel both of those for a full minute. Post-tibial, which is in here. Good. And then your, what are they called? Dorsalis pedialis on your feet. Good. So those are +2. I could feel all those, which is normal.
Good.
Reflexes, I don't have a hammer, but if we were checking reflexes, check your knee, hit it. Your Achilles, which is in the back of your heel. We would do your brachioradialis, which is right about here. Your bicep, which is here. And then your tricep, which is back here. I don't have one of the hammers to check it, but we would check it. So Homan sign, whenever someone has a, what am I thinking of? A blood clot in their leg, you would do the Homan sign. To do that, I would have you hold your leg straight out, do that, dorsiflex your foot, and grab back here. And if there was pain, redness, swelling, it would most likely indicate a blood clot. They would do further testing, but that's the Homan sign. What else? Check your feet real quick. No swelling, good. Nice and warm. Some varicose veins, which is normal. Good. Alright, joints. So for your fingers, have you do all your finger joints. Do you have any arthritis in your fingers?
Oh yeah, all here.
Yeah, they're a little swollen.
Yeah, this hand's swollen.
But you can move them good.
Oh, yeah,
Everything moves good.
Yeah,
All right, wrists, twist them for me.
Oh yeah.
Good. Elbows, hinge them for me. Good. What else do we have? We checked your temporomandibular joint with that. Your cervical spine. I'll have you stand up. Move your neck side to side. Up, down. Go around. Good. We did your shoulders. You can shrug those. Hips. I'll have you move side to side. Check your hip joints in a circle. Good. Knees. Can you do this for me? Good. Other leg. Good. Alright, have you sit back down. I'm sorry. Ankle, can you twist it in a circle? Good. Other one. Good. And feet, I'll have you wiggle your toes. No problems with your toes at all? Good. Felons and tunnel sign checks for carpal tunnel for people that have carpal tunnel. Does that hurt at all?
Just
No.
a bit. It hurts my thumb, but
Does it?
I think I
Do
have.
you think you have any carpal tunnel? Have
A
you
little
ever?
bit hurts up here.
Does it? Alright, and then I'll have you put both arms out here. We do this. This is Tunnel sign. Does that hurt? No. Okay, do the other one. Say this is supposed to help with carpal tunnel. I don't know how accurate it is.
Yeah.
Okay. Alright, and then the only thing left to talk about is self-breast exams. Women are supposed to do those once a month. You can do them in the shower, lying down. They tell you to put your arms at your side and then back up top. Do it different ways, but you start on the outside and move circular, like using the pad of your fingers. You're supposed to feel for lumps, hard knots. You're supposed to inspect your boobs in the mirror, make sure there's no abnormalities. Nipples look the same. One doesn't look bigger than the other. There's no discharge. but it's important for women to do those once a month. And you get your regular mammograms, right?
Oh, yes.
Good.
Every year.
All right, I think that wraps it up. Do you have any other questions for me today?
No, thank you, Brittany. You've
No?
done a wonderful job.
All right.
Thank you.
It was nice meeting you, Julie.
It was nice meeting you
Have a
also.
wonderful day.
You too.